I am Lieutenant General Dr. Vimal Arora, Chief Clinical Officer, Clove Dental. Well, COVID was a learning period for us, as I mentioned to you. Post-COVID, we have learned that if the dental problems are not heeded to in time, they will definitely grow to a level that it will be much more painful to you to treat them, not only to your body but also to your pocket. You're going to spend much more to treat if you're not taking full care of your teeth. Post COVID has clearly brought out this issue. Whenever there was a negligence on the part of the person not to look after the oral health at the right time, the person had to get longer treatment done, multiple sittings, painful, and spent more money. As far as the company is concerned, we learned that we were already the best as far as maintaining our sterilization, asepsis, and disinfection is concerned in our surgeries. We also pumped in the latest equipment to make sure that the environment in our surgery is virus free. So we brought in continuous fumigation devices, and we also brought in aerosol suction and disinfection devices, which we placed in each surgery all over India to make sure that every surgery is absolutely virus free. And we laid specific attention on achieving the highest degree of sterilization in each surgery. And we are very fortunate and we are very proud to say today that we had almost a nil contamination or nil cross contamination rate from our dental clinics. We learned and we improved and we became better, and we are continuing with this practice. When we talk of taking dentistry to home, let us understand there are some limitations of doing dentistry at home, because we have a problem of giving anesthesia without proper armamentarium. We also have a problem of waste being generated and how to handle emergencies. But if all these things have to be done, they have to be done by a qualified, experienced dental surgeon who is trained in home health care. Of late, there has been a lot of talk in the media as well as amongst the dental council also, that who can go to home and provide dental diagnosis or dental investigations or dental care. I am very clear in my mind that no dental care can be provided to anybody except a qualified dental surgeon. And that qualified dental surgeon also should have certain experience of providing home health care. Because when you are doing any treatment, you have to be specially trained for that. And you should also know how will you manage the biomedical waste, and also how will you manage the sterilization, asepsis, and disinfection in that environment, which is the alien environment for you. When we talk of expansion plan, I would like to cover it in two parts. One is my clinical expansion, other is my business expansion. When I come to clinical expansion, well, we have created 342 clinics across the country. They are providing a beautiful nidus or nucleus for further expansions. We are expanding not only in number of clinics, we are going to expand in the number of super specialty treatments which we are going to add upon. We are going to make the advanced surgical treatments available at every possible clinic, the advanced laser treatment at every clinic, the advanced implantology at every clinic. We have plans to add the clinical specialties of the futuristic scenario in every clinic, like full mouth rehabilitation, using implantology and using the guided prosthesis. We are talking about the latest pain relieving mechanism of TENS and ultrasonography to make sure that atypical facial pains disappear. We are talking about equipment to understand the jaw dysfunction syndrome better and how to treat them. So our plans on one side, while business wise, are expansion in clinics, but on the other side is expansion in clinical services, adding more technology, adding latest materials, and adding the expertise to become Clove become as the one of the topmost places where every single specialty or every single advancement is practiced. When I talk of business, we are at present having 342 clinics across the country which are functional. We would definitely like to double this number, or rather take this number to something like 800. That is what is the plan in the next 3 years. And initially, probably we are going to be expanding in the cities where we already are, or we already have the NIDAS, or we have our system. In addition to this, the supporting services like our laboratory, that will also be expanded. And also the other support functions will also expand to all those areas. So the plan for business, we are poised to expand in the next 3 years at a very rapid pace, taking this number to double the number at least, if not more than this.